Far. Thank you for coming on the show. Dr. Anderson, this is exciting because you're actually able to reverse the effects of neuropathy through surgery.
Correct.
Tell me a little bit, what does that mean for somebody?
Well, first of all, neuropathy is very devastating to some people. They get a lot of burning, tingling, numbness, pain, and it's a sort of a 24/7 thing. It's going on all the time, and it affects them a great deal. And if we can help them, sometimes helps them get off drugs. A lot of people are medicated. They have sometimes bad side effects from the drugs that they're taking. Some of them might even have to resort to narcotics. And I really think sometimes in healthcare, a lot of doctors don't appreciate the amount of pain that these people might have and how it affects them, even in their personal life.
So the narcotics is just masking the situation.
Correct.
Let's jump back a little bit. Explain to me what neuropathy is.
Well, you get burning, tingling, numbness, hot or cold feelings in your feet, sometimes weakness, and it's usually going to be on the top and bottom of the feet. It's all over, and sometimes extend up even to the knee joint.
Oh, that's horrible.
Yeah.
These diagrams we're looking at right now, does this help us kind of understand the surgery part
Yes,
of it?
exactly. The surgery part of it is that we do, and again, I've been doing this for about 8 years. This is explaining a little bit about diabetes. And diabetes, because the sugars are higher, you've got a sugar molecule, it's called sorbitol, and it will reside in the nerve, and it actually makes the nerve swell. Sorbitol attracts water to the nerve, and when that happens, nerves can become about 40 to 50% larger in diameter. And so on the next slide, you can see that when you're looking at a nerve going into a tunnel, in the case of the foot, you could call it the tarsal tunnel. In the case of the hand, you could call it the carpal tunnel. But that tunnel size doesn't get any larger, but the nerve is larger. So it's going to squeeze on the nerve. Nerves don't like that.
Yeah.
And then you can get these symptoms. And so in a diabetic, you've got a perfect situation where you've got, number one, you've got maybe an enlarged nerve. And then secondly, if they're born with a tighter nerve tunnel, they're going to get compression on that nerve. And it's important for our audience to know that probably more than half the patients that we treat are not diabetic. They're patients without diabetes, but yet they have neuropathy. And they simply, we feel, just have tight nerve tunnels. And we just decompress them, open them up, just like doing carpal tunnel surgery.
Okay, so Dr. Anderson, you're able to help them with the numbness,
Correct.
the tingling. But what about balance and instability? Will the surgery help with that?
Oh, yes, it definitely can help with that. When people are suffering from instability, what's really happening is they can't feel the bottom of their feet. They don't know where their feet are. It's kind of scary.
Yeah.
It's like they're walking on a board.
So they can't feel it?
So they can't feel it. And secondly, the muscles and tendons that move the foot up and down, flex and extend it, or move the feet side to side are oftentimes weakened. And that's how the surgery can help.
What's the success rate on that?
It can be as high as 80 to 90%.
That's good.
And not everybody that has a surgery is 90% better, but even sometimes if they're 30 or 40% better, that's a huge improvement to their life. They may be able to get rid of a cane or maybe go without a walker. It helps a lot.
I understand you're working with Colorado State University for research on this.
Exactly.
How is that going so far?
Very well. And Carla was in our study, but we're really wanting to show in the medical literature, really show more evidence of how successful. I've seen this working for several years now, but we want to really document the improvement that we can see. And we have people go in before surgery, and then we have them go in usually about 3 months after surgery so we can compare the before and after effects.
Well, I'm going to have to talk to you off the show a little bit later, too, because we mentioned bunions, and my gosh, do I have some...
I noticed.
Yeah, well, thanks so much. You're not supposed to say that. All right, Carla, let's focus on you, hot stuff. Tell me about Carla before the surgery, because I know we have video of her and how she was walking and trouble walking before she actually had the surgery.
Yeah, this is one of the tests that they do at CSU, and it's a test where they have her sit down, they have her walk a prescribed distance, and then they have her go back and sit down in the chair again. It's very simple, but they time it. Oh. And this is her before.
A lot of pain there, struggling.
Yeah, some weakness, probably can't feel her feet. And then this is her going afterwards.
Wow.
Looks like she's had a couple cups of coffee there. But it is from the nerve function. It's improved, and you can see that. And there's many other tests they do. That's just one component. Of the testing.
Well, walking in here today, I would have never realized that you've suffered from neuropathy so difficult in the past. But explain your situation, what it was before you saw Dr. Anderson.
Okay. Well, about 1996, I started having some back surgeries, and after that, the neuropathy was really bad in my feet and ankles, and even up through my knee. And my balance was off. I was always falling. I was on 3 pain meds, and then that on a, say, pain scale 1 to 10, 10 being the worst, I was probably 12.
Oh, you're kidding. That's horrible.
It's very painful, and I had the feeling like there was a big elastic band around my feet and stuff like that. So it was
you
bad.
had surgery. You're feeling
I had
better.
surgery.
But what was the surgery like?
The surgery, I just wanted to mention a few things about the surgery. Pre-op, I went in and Dr. Anderson went over the surgery, you know, what it would be like. I got prescriptions for pain or nausea after the surgery, so I had that on hand when I got home.
Right?
Yes, just in case. And then nurses met me at the door. I went in, they put in an IV, monitored my, you know, blood pressure and everything. Anesthesiologist came in, talked to me, told me what it was going to be about. Went in, had the surgery, came out in recovery, and went home.
And now?
Now it's great. I'm down from 3 pain meds to 1.
Good.
My balance is 100% better. I mean, my balance is unbelievable now.
That is so important in life. People just don't realize that they can get help with this. What kind of special do you have for our viewers who are tuning in today?
Yeah, well, for now we're having a free initial appointment if they want to come in and learn more about this, where we evaluate them, and that's something that we're offering today.
Why are you so interested, doctor? Take me to the beginning of you deciding, okay, this is where I want to focus my practice.
Well, I mean, just personally, it's extremely rewarding to help people. You're helping people in a very big, broad way, not only just with neuropathy, but even more specifically those that have the weakness and balance issues, because I think for their general health it's so important. I have patients that maybe were looking at going to a walker and now they can walk on a treadmill and they're working out. So just for their entire body and their entire health, it's such a meaningful thing to do for people.
That's fabulous. So. You guys don't give up. You got that. If you're having problems with balance, neuropathy, instability, contact Dr. Anderson, 1-800-866-4620. When do you think Carla will be at that point to where she's completely off of her pain medication and just cruising?
Well, she's out, what are you, probably about a year, not quite a year.
September, oh no, yeah. July. July was my first.
So, I mean, she's probably got about 6 more months that she could still be improving. Sure.
Good for you.
It's possible, definitely.
Congratulations. Thanks
Thank
for
you.
sharing your story.
You're
and
welcome.
I know she came all the way from Wyoming because this guy